If you have cancer, doctors can treat you by shooting high-energy rays to the affected area. These rays are full of radiation, which are meant to kill the cancer cells. However, sometimes they end up damaging your healthy cells, causing you to get sick and even lose hair. When you get a hair transplant, doctors make an incision on the back of your head and rip off a chunk of your skin. They then sew the wound together and begin harvesting hundreds of hair follicles from the extracted skin. Afterwards, they start injecting them into your balding spots by cutting small holes in your head and placing the follicle in. And in just a couple of weeks, the hair will be growing back to normal. When you get stitches, a doctor uses a needle to sew your wounds closed, pulling the edges of your skin together. At first, the wound gets a bit swollen as new cells start to repair the damaged tissue. Your body then creates connective tissues and collagen, which later becomes skin to fill in the wound. As the wound gradually heals, blood vessels are formed to nourish the developing tissue, and after a few weeks, the stitches are removed and your skin is back to normal. When you get a vaccine, doctors are actually injecting a pathogen into your body. This triggers your immune system to react as if it was a real infection and produce antibodies which fight off foreign pathogens. Now, this way, if you encounter a dangerous pathogen in the future, your body remembers how to fight it, which protects you from getting sick. If you're severely obese, you can give surgery to remove the excess fat. This is called liposuction, and it's when a surgeon puts you to sleep and inserts a tube into your body to suck out the fat. During the process, the surgeon moves the tube around to avoid taking too much or too little fat, ensuring a natural look. If your eyes point in different directions, a doctor will make a tiny cut in the thin covering of your eye. Then they'll lift the exposed muscles from the eyeball, moving them slightly to help your eyes line up straight. Once they're in the right spot, the doctor stitches the muscles firmly into place so they stay aligned. Finally, they close the tiny opening on your eye with small stitches that dissolve over time. And once it heals, your eyes stay aligned and point in the same direction. The surgeon makes careful cuts inside your mouth, along both sides of your lower jawbone. Then they separate the jaw and slide it backward into a new correct position that lines up with your upper teeth. Once it's aligned, they secure it in place with tiny metal plates and screws. Finally, dissolvable stitches close the cuts inside your mouth. As your new jaw heals, the bone fills the gaps and locks the position permanently, fully correcting your underbite. Brain surgery is sometimes performed while the patient is awake, and this is done to help surgeons avoid damaging critical brain areas. You see, they'll ask the patient